Claudia Webbe.
Thank you, Mr Deputy Speaker. Firstly, I'd just declare that I'm a member of the Backbench Business Committee, and I thank the Honourable Member for Brent for bringing this debate with us here today. As the representative, of course, of Leicester East, one of the most diverse constituencies in the country, it has been extremely concerning to see the disproportionate impact of the coronavirus upon African, Asian and minority ethnic communities. This was proven, of course, by the government's own report, which they shamefully only published after repeated pressure and which does not outline any protective measures to deal with the disproportionate impact of Covid-19. You see, I worry in a constituency like mine, which has a significant number of people from the affected communities. I worry about the processes of tracking, testing and so on, and whether or not that will be put right. Because you can imagine, if there was a second outbreak, what that impact would have on constituencies like mine. We already know that the Office for National Statistics found that black people are 1.9 times more likely to die than white people. People of Bangladeshi and Pakistani descent are 1.8 times more likely, and people with Indian descent around 1.5 times more likely to die. These figures reflect the severe racial disparities in our economy, of course. We already know from the Resolution Foundation think tank that estimate that black, Indian, Pakistani and Bangladeshi employees experience an annual pay penalty of 3.2 billion. The analysis from Public Health England showed that once in hospital, people from African, Asian and minority ethnic backgrounds are also more likely to require intensive care. So these communities accounted for 11% of those hospitalised with Covid-19, but over 36% of those admitted to critical care. Many have tried to dismiss the imbalance in deaths as being explained by cultural or even genetic factors. I've been dismayed by some of the information that has come through my inbox about what people need to do to tackle these genetic problems. Yet discrimination is not about that. It's deeply ingrained in the social, political and economic structures of our economic system. The scourge of institutional racism results in unequal access to quality education, unequal access to healthy food, unequal access to livable wages and affordable housing, which are the foundations of health and well-being. This is the context in which the coronavirus crisis is operating. The virus itself may not discriminate, but our economic and social system certainly does. Existing racial and class inequalities, coupled with inadequate government support, mean that working-class communities, migrants and African, Asian and minority ethnic communities are at greater risk and exposure from Covid-19. The severe racial disparities in our economy mean that these communities are more likely to fall through the cracks in government's financial support and therefore more likely to be forced into work in unsafe conditions. A decade of cruel austerity has deepened the racial and class inequalities that exist in our society. Last year, we know from a Special Rapporteur report for the UN Human Rights Council, when they reported on discrimination in the UK, we know that its grim findings reported, and I quote, "Austerity measures in the United Kingdom are reinforcing racial subordination." The NHS staff are at considerable risk from the virus, as we know. And it's vital, of course, that we repay the extraordinary contribution of frontline workers with a permanent extension of migrant rights. That means an end to the hostile environment. It means shutting detention centres and ending those. And it means granting indefinite leave to remain to all NHS workers, to carers and their dependent families. Recent reports indicate that migrant NHS workers and carers are still being charged for using the health service that they work in. And that's despite the government saying here that it will end that. And yet, it is still the case that migrant workers are being charged. As the inspiring crowds of protesters across the country have shown us in recent weeks, it is crucial that we in the UK do not assume that we are immune from the disease of institutional racism. The failure of the government to outline any protective measures, despite being evidently aware of the disproportionate impact of COVID-19, is yet another instance of the institutionalised neglect of African, Asian and minority ethnic communities.